So I sent in a FOIA to Illinois DCFS recently about children in their care who do not have registered social security numbers. And they responded to me that they did not know exactly what I was asking for, and they wanted to set up a conference with me with multiple members of their staff to discuss this. I also, at the same time, presented the same FOIA to the Department of Human and Family Services, HFS, and I asked them the exact same questions. They had no pushback, and they actually informed me of 20,358 undocumented children on Illinois Medicaid. They do not have a social security number. Right. And I've also seen documentation where they've had problems with certain agencies asking or requesting for social security numbers for these children. So that also could lay in the 10,000 that are ages in the age of zero. But anywhere between 1 and 17, I don't think there's any valid reason to not have a social security number registered if they're American citizens. I did an average search to see how much it would cost one child on Medicaid here in Illinois, and an average would be about $11,000 per child. Now that would be assuming it's your well child visits and your regular visits that you would have, no additional medications. But if you've got a child with more difficult medical conditions or who needs to be on a lot of medication or in hospitals for a long period of time, with the average of 11,000 per child, we're looking at roughly $224 million in taxpayer burden. I think there needs to be extenuating circumstances for any type of public payment for someone who's not participating in being an American citizen. I don't believe that we should be paying or having the tax burden of every single child that enters our state, especially with the sanctuary laws and the things that our governor has been illegally doing, including warning with DCFS and other state agencies. He warned daycare agencies on how to handle if ICE were to show up looking for these children. That just creates, in my mind, a very gray area of what is happening to these children. Is this about protecting them, or is there something more sinister going on? And without DCFS giving me these answers, I don't know what to think here. I'm going to continue pushing forward. And if DCFS cannot provide me with corresponding paperwork, I think we've got a pretty serious issue here. So my campaign slogan is going to be full disclosure, full exposure. I am an open book. I will ask any question that someone wants to have asked, and I will answer any question that is asked of me. And I do believe the most important thing we could do here is get an independent third party audit, and it needs to be done statewide in any agency that deals with children.